Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
How Shelby County is responding to increasing cases of coronavirus. Tonight on Behind the Headlines. I'm Eric Barnes at the Daily Memphian, and thanks for joining us as we continue to do the show remotely. We will be talking about coronavirus again, and we start with Mayor Lee Harris from Shelby County. Mayor Harris, thanks for joining us.
Thanks a lot for having me.
Dr. Alyssa Haushalter is director of the Shelby County Health Department. Dr. Haushalter, thanks for being here again.
Thank you for having me as well.
Along with Bill Dries, reporter with the Daily Memphian. I guess I will start with you. Normally we start with the mayor, but in this case, we're going to start with you, Dr. Haushalter. The cases nationally, internationally are up in some cases. Some hotspots in North Dakota, and stories about El Paso, and stories about just around the country, really severe increases in the coronavirus. Case rates here are up, and I'll let you go into the numbers and the trends, but generally we're up here, not as bad as some places, but we're not as low as we were. How concerned are you, and where do you think these numbers are going in terms not just of cases, but of hospitalizations, positivity rate, and all the numbers you look at?
So we are concerned. We're seeing a slight trend upward in a variety of areas, everything from our 7-day average to our positivity rate to hospitalizations. What we want to do is really make sure that people understand we still have the ability to reduce transmission locally, and that's by masking, social distancing, and making very sound choices as individuals and family members to reduce transmission. And if we're able to do that, we won't necessarily have to move towards closures like we did at the early part of the pandemic. What we do know is the context is very different now. Back in March and even in June, July, when we implemented some closures, there wasn't as much transmission in the rural communities. And so now with widespread transmission, local interventions have limited impact. We really have to focus on behavior change.
If you do have to go to closures, do you have sort of the priority closures that have the most impact? I mean, what would you have to close if we get there?
So what we do know, and this is by nationwide data, although we knew this earlier on in the pandemic, any place where an individual can't wear their mask for the full time and is indoors is a high transmission area. So restaurants, limited service restaurants, gyms are places that are seeing transmission nationwide. So those are the places that we would try to, I would say, curtail transmission. Doesn't necessarily mean closures. It could mean reducing capacity again. It could mean reducing hours again. I really encourage people, if they're going to visit a restaurant, limited service restaurant, or a gym, to do that in off hours when there's the least amount of people present.
Let me go to Mayor Harris. Mayor Harris, we'll come back to a number of things that Dr. Haushalter raised, but one is this sense that of the patchwork rules, right? Memphis has a set of rules. They're somewhat different even in the suburbs within Shelby County. They tend to be quite different in rural communities around here. And then we are bordering Mississippi, which has its own set of rules, and Arkansas, which, again, a whole different government over there. What can you do, if anything? I mean, you are only the mayor of Shelby County. There are a lot of different political players. I don't mean only, sorry, I didn't mean it in the way that may have come across. But in this case, with this patchwork of rules that the coronavirus doesn't abide by, right? I mean, it doesn't care. What can you do? What have you tried to do to create maybe some more consistency, some more commonality, some more agreement over how we as a region approach this?
Right. So I think you put your finger on a really important issue. And the answer is it's a good news, bad news situation. The good news is locally, the 7 municipalities that make up Shelby County have all worked well together. We have all been in harness since the beginning of this pandemic. We all talk regularly and discuss the various options with each other. Everyone is heard. And in fact, we just had a meeting together just before this videotaping. The bad news is we can't control the borders around Shelby County, and the virus doesn't recognize the borders around Shelby County. And so if the problem is the virus, and that problem is affecting all of us, we're going to need a higher level intervention. Obviously, we would love to have a more robust federal response, but if that is not available, then a more aggressive state intervention, I think, is in order. So we have seen state intervention with respect to at least 2 areas, but really many, many more. But the ones that have caught the public's attention are weddings. Weddings have been taken back by the state and regulated only at the state level. And high school football. High school football has been taken back from the state, the actual play of high school football, and regulated only at the state level. There are other areas, I would contend, more important areas that should also be regulated at the state level. It'll give us a more uniform approach, which is going to be more impactful with a virus that doesn't recognize a difference between the rural areas and the urban areas, a virus that doesn't recognize borders at all.
What are those areas? And then I'm gonna go to Bill.
Well, I think that the 2 areas that are top of my mind are a mask, is that the more we can do to create a mask intervention, a uniform mask intervention, the better. And so we're talking about the statewide mask mandate that has been talked about ad nauseum at this point. But it really it bears repeating because we're in a wave. In other words, our hospitals will be strained and we're in a wave. So this is the time for the governor to act on a statewide mask intervention. At the same time, the other one I'll mention, and this is a little more longer term just to make sure that people have access to healthcare, is Medicaid expansion. No part of our state has been impacted more by the failure to expand Medicaid than West Tennessee. We've seen more hospital closures here than anywhere else, and that's going to have a major impact when people are in need of healthcare access and vital treatment. And the third area I'll mention is schools. We have a patchwork of approaches with respect to schools, and partly as a result of that patchwork, our kids have borne more than their fair share when it comes to this virus.
Okay.
You know, I think the local powers are great, but the reality is it does strain credulity to think that local government can both manage the economy, the schools, and confront a 100-year pandemic. We're going to need at some point an aggressive response from state and federal authorities.
All right, we'll touch on much more of that. Let me go over to Bill.
Mayor, the mayors of Bartlett and Germantown have both said, yes, the governor needs to implement a statewide mask mandate. At your meeting this morning, Thursday morning, as we are recording this, is there any sort of unified statement coming from the group of mayors within Shelby County on that?
So what I will say, I'll speak for myself. I don't usually talk about conversations other than my part of the conversation. What I expect to do is to convene a larger meeting of leadership from across the counties in West Tennessee, because there is a vacuum to be filled. I think that if we can't get the governor to take on this role of aggressively responding to the pandemic through a mandatory mask regulation, then we're going to have to fill that vacuum at the local level. So we're going to have to convene more of the counties and their leadership and try to see if we can get an informal or maybe even a formal agreement among that leadership that we're going to step into this gap and we're going to act if we can't get the state to act on protecting us through a uniform mask approach.
Mm-hmm. Dr. Haushalter, we have this emergency facility in what used to be the Commercial Appeal Building on 495 Union. And there was a lot of discussion about that. Then there wasn't a whole lot of discussion about it. From your perspective, where are we in terms of having to use that facility?
So at the current time, there's not a need to open the facility. While the hospital systems have been strained, they've been able to manage capacity. I do want to remind Shelby County that the alternate care site, or the old Commercial Appeal Building, is actually a state asset. So the state will make a decision when that building is open and how it will be staffed. There is a weekly meeting that we call the surge meeting. So hospital systems meet weekly to discuss where they are relative to capacity, what their concerns are, and preparation for opening the commercial appeal building if it's needed.
Mhm.
We stand ready, but it's not necessary at the current time.
So much of the discussions we're having now seem, at least to me, to be about a longer term approach to this. Even with the vaccine coming, so we hear, it seems as if the measures we're talking about are more of a realization that this is something we're going to be dealing with even after a vaccine. We're going to be dealing with the logistics of that vaccine. Am I right on that, or am I just not hearing things right on this?
No, you're definitely right on that. We have to be prepared well into 2021. Although within public health, we had always anticipated that this would go into 2021 at least, even if there was a vaccine. I think what's the big shift is that in the early part of the pandemic, you saw cases in the metro area, so Shelby County, Davidson County, but now you have cases statewide. And when we had the visit from the White House team in June, one of the things that the Assistant Surgeon General said to us is you're going to get to a point where you have to learn to live with it and learn to manage it because it's going to be so widespread within your community. So we did very good at containment early on and some mitigation, but mostly containment, which is an earlier phase. Now we're learning to live with it collectively, and we have to anticipate living with it well into 2021. And masking is going to be a critical component of us reducing transmission and deaths locally.
Before we go back to Eric, Mayor, let me ask you about that longer term approach, and specifically your call for a Medicaid expansion, which would be a long-term measure, perhaps the ultimate long-term measure in all of this. Where do you think the state is on this? Because this will be an issue that goes to the Tennessee legislature.
I'm not sure is the answer. When the pandemic started in March, we convened a meeting with the governor. I laid out the hospitals that had closed in West Tennessee and why we would be unprepared if this were to continue without a more long-term approach, including Medicaid expansion. We told the governor about this need and how it had affected West Tennessee, not just Shelby County, but the counties throughout West Tennessee. And so it remains to be seen whether or not that presentation had some influence. I don't know. They're talking about a special session right now to confront the health departments in urban areas. That's probably not the best purpose for a special session. If you were going to do a special session at the state level during a pandemic, you would probably do one to make sure that communities have the resources they need to respond to the pandemic and make sure that the hospital systems were strong during the pandemic. That's what it seems to me. So what we're going to do is what we can control, and at the local level, what we can do is do a couple things. We can respond to the immediate needs, which is what you see Director Haushalter and the health department doing every single day, and then we can do some long-term planning, such as possible with the powers that we have. And so one of the things I pointed out this morning and that I've told repeatedly to county commissioners and so forth is that our CARES dollars will expire at the end of this year. And those dollars help fund our COVID response. And so we are now positioning to make sure that COVID response can last at least until March 31st, identifying resources that can fund COVID response through March 31st. And at the same time, planning a permanent COVID response that will live on after March 31st. That permanent COVID response would be much less than what we're doing right now. But the point is that this cannot, our capability, our capacity to respond to COVID and other emergencies can't go away. And so we have to keep thinking both long-term and responding to what is happening on the ground every day.
A quick follow-up, if I could, Mayor. You talked about a possible special session on the urban health departments. Would this be the proposal that Speaker Sexton has talked about to make the health departments here and in the other major cities less autonomous?
So I hate to talk too much about it because I have not personally talked to the speaker about his plan with respect to urban health departments. And I'm not sure if he's talked to, I don't think he's talked to our urban health department, and I'm not sure if he's talked to any urban health department. It's not clear quite yet. But yes, that's the special session that we see sometimes in the headlines from afar about what should be the top issue with respect to the state's interest in pandemic response. I disagree. I think the top issue from the state's perspective when it comes to pandemic response should be about how you make sure that the communities have the resources that they need, that the residents are protected, and that the hospitals are in a position to deliver care when needed.
Let me go one follow-up question. I mean, there's so much that we're touching on. I can follow up on everything, but Mayor Harris, you said that the CARES Act money runs out at the end of the year. You're trying to work to extend that through March 31st. What services or what is that going towards? Is that contact tracing? Is that what is that money is going towards that is running out?
So I think we've identified a way to continue the COVID response through March 31st. The details of what is in the COVID response, Director Haushalter, I think is ready to talk about. And then again, after March 31st, we will try to figure out permanent funding for some level. It'll be a diminished level, but some level of response going forward after that.
So, Dr. Haushalter, what are those services that you're worried are running out and that are going to be extended through the 31st?
Yeah, everyone thinks of contact tracing, but that's just a component of what we do. So one of the key things that we do is surveillance and data, and what we call democratizing data, or getting that data out so that other people have information to make very good decisions. That's one of our strengths locally, is data and being able to get that out on a daily basis. The other is case investigation, and from the case investigation is where we do the contact tracing, and that's also where we get people isolated and quarantined. So that's a containment strategy. The other is enforcement. We work very, very closely with businesses, schools, and a variety of others to provide technical assistance on how to, one, open classrooms safely, how to operate your business safely, and then if there is an issue, like a complaint that's received, we then follow up with additional technical assistance and potentially closure. So it's all of those things wrapped up in the team. We have well over 200 positions that are dedicated to COVID response, and then we have many other employees who get reassigned to assist with the particular items that I mentioned earlier.
Of all the, I don't know how to ask the question, so I'll fumble my way through it. In terms of contact tracing and the research and the follow-up you just described, which I'm summarizing, as contact tracing, what percentage of the actual people who test positive are you able to do a full-blown research and follow-up on?
So we're actually able to do the full research on a significant number of people, somewhere upward around 70% that we reach at some point. I think the real critical question is how quickly do we reach those individuals? And our goal is to contact people within 24 hours of when we receive notice. And then if not within 24 hours, 48 hours. And that's well over 40% that we reach within the first 24 hours. We rely heavily on others to help reinforce that if you test positive, stay home. So that coordinating with testing sites to make sure the message is, one, if you get tested, stay home till your test result comes back. If you're positive, you isolate for 10 days and the health department will contact you. So none of this is done in isolation. We really are one large system trying to get people isolated and quarantined.
Let's talk a bit about testing. What is our testing capacity right now? And when I ask that, I'm also kind of confused. I mean, everything from a local drugstore to the county health department to some of the, Church Health and Christ Community, the hospitals. What is our testing capacity? And for people who want to get tested, what should they do?
So our testing capacity is actually thousands per day. We have very significant capacity locally. It's also a testament to our partnership and a systems approach. So yes, you can get tested at the health department, you can get tested at a pharmacy, you can get tested at a safety net provider, you can get tested at a private provider. So people have many options for testing. If someone's interested in getting tested, they can go to shelby.community, and there's a link there that takes them to all the listed testing sites. Many of them have appointments, and some of them you don't require an appointment, and the majority of those don't charge a fee. So it's another strength locally. People can access testing regardless of whether or not they have insurance.
What about testing is, correct me if I'm wrong, is sort of only as good as the turnaround time, right? Because what you want a quick test so that you know you are infected and you quarantine, rather than waiting 48, 72, 3, 4, 5 days during which you've exposed people because you didn't get your positive test back. What do you know about turnaround times?
So we actually get data on turnaround time a couple times a week. Locally, turnaround time is 1 to 3 days, but most test sites turn around in 1.5 days. Now, the other issue is, what is turnaround time? So that means they report to the state within 1 to 3 days. Because the state system is exceptionally burdened because the number of cases statewide, it may not actually come to our health department for another day or two. So the labs are turning around, they're getting the report to the state very quickly, and the state may take another day or two to get it to us.
And I'm blurring my language, so thank you for correcting me or clarifying. Turnaround time to the person who's been tested, did you say that was averaging 1 to 3?
That's 1 to 3 days.
Well, and again, it's a patchwork, right? It's everything from private providers to public and so on. If someone is waiting, and I've heard purely anecdotally, of people who've waited 3, 4, 5 days, should they just go get tested again? Or what should they do? Because I think it's a very powerless feeling for people who are concerned. They're concerned about themselves, their family, people they may have exposed, and they're waiting, and it's been 3, 4, 5 days. What should they do in that circumstance?
So generally, they should reach out to the provider that tested them to see what the challenge is. I have heard people say they didn't receive a report, but they actually had an online report that they hadn't viewed. So first is to reach out to that particular provider, and yes, they could go get another test. I would encourage them to get a second test if they are symptomatic and haven't heard in a timely manner. I wanted to add one other thing that I think is really critical, and it's based on our data through contact tracing. We know that of the last 500 cases that we looked at, a little bit under 500, it's about 460 something, 53% of people who were symptomatic continued to go to work while symptomatic. So testing is important, but the key message I want people to take away is that 1 person out of 5 is asymptomatic locally. That means 4 people out of 5 actually have symptoms of COVID and continue to go about their activities of daily living. So I want people to think about, if they have any mild symptoms of upper respiratory infection or the flu, that they need to avoid being around other people and get tested.
Okay. And I can tell already we're going to probably go a little bit long today and add some onto the podcast. So there's some questions we may not get to on the broadcast if you're watching this on TV, but we'll be on the podcast, which is available on Daily Memphian or wherever you get your podcast. Let me go back to Bill with just 3 minutes left here in the broadcast show.
Mayor, after much delay and much discussion, there is now a Shelby County Public Health Board, a goal that was pursued by your administration, by Dr. Haushalter. Tell me what that means to the long-term perspective on not just coronavirus and COVID-19, but public health in general in Memphis and Shelby County.
No, I think that's right, is that this pandemic hopefully teaches us that we need to make long-term structural reform with how we approach public health. And that includes investment in public health. And we'll be talking about that, a long-term strategy to invest in public health. But it also means just making sure that that public health has the capacity to respond to these kinds of emergencies. And that's what the Public Health Board was about. It was, how do you make sure that there is sufficient expertise that the health department can access regularly and on an as-needed basis. And so the Public Health Board was approved by the County Commission after some debate. That's true. Was approved by the County Commission, and it'll serve as an advisory function to the director of the health department and other leaders in public health, so that we can make the very best decisions about how to keep everyone safe and healthy. So there are other long-term strategies that are in the hopper, and you'll see more of that, because again, as I said, we got to do a dual track. We've got to do the immediate, and we've got to think about long-term structural reform.
Mhm. Dr. Haushalter, what does having this board mean to you in terms of doing your job? Because there was some version of this when you worked in Nashville.
Yes, one thing I want to point out is the local board would be an advisory board, which is quite different than Nashville, Davidson County, where it's a governing board. But what it does do for me and other public health leaders is it allows us to have expertise from different sectors, particularly the healthcare sector, but also from the veterinary sector and so on, to be able to provide advice to us, for us to be able to share ideas and get input and feedback so that we make the most sound decisions for Shelby County possible. But for me, as a long-term public health leader, it really is establishing a framework for the future that's important to me, is that having an advisory board for future directors is critical as we look at the role of public health in improving health locally and ensuring that we have the appropriate structures and systems in place to do all that we can to improve health outcomes. We have a pandemic now, but we have other significant issues locally that we need to tackle, and the board will be instrumental in helping us develop plans to move forward.
Let me go to you, Mayor Harris. You mentioned schools, and also for you, Dr. Haushalter, but I'll start with Mayor Harris. The impact on schools, we've talked to, I think, in the course of the last 6 weeks, every superintendent from the suburban school districts, Shelby County, Joyce Ray as well. It is such a difficult situation. Two-part question. Should Shelby County schools go back to in-person learning in January? And what do they need to do so safely?
I think that's the preference, is to offer in-person learning instruction, because the cost borne by kids and families is significant. The learning loss and so forth. What we have to do is try to make sure that school leaders and families are comfortable with a return to the classroom. And so that's going to include things like making the buildings safe. And so you've heard the superintendent rightly talk about the ventilation system and how that can be deployed to reduce the risk of transmission of the virus. That also means making sure that those who have vulnerabilities, whether teachers or students may have family members at home that have respiratory issues. Teachers may also have those kinds of issues. And so in those kinds of cases, you got to make sure there's an option for them as well. And it also means, to a certain extent, is revisiting hazard pay and benefits for teachers, because they have to be in a position to take care of themselves. They have to have the sick leave that is necessary if they have to take time off. And so those kinds of things have to be revisited. So the safety of the building, the hazard pay, and the benefits of the teachers, and making sure there's an option for those individuals who have medical vulnerabilities. But yeah, I think that in-person instruction is better for the kids. And I think that kids and families have borne a great deal of hardship during this pandemic. And we have to try as best we can, and as fast and as safely as we can, move them back to in-person instruction.
Dr. Haushalter, can Shelby County schools reopen safely given the resources it has, given the facilities it has?
It can reopen safely, but the other thing I would add to what Mayor Harris said is that it's critically important that we get community transmission down. The more that we reduce community transmission, the safer schools will be, because our reproductive rate will be lower. The schools have a really strong plan in place. We work closely with all the schools, not just Shelby County schools. And so we're there to provide technical assistance as well as some other experts. So I feel confident in their ability to move forward in January, and to garner additional resources when needed, but also to use the resources that are already in place.
Right. And I should say that, we talked to all these different superintendents from Arlington, Millington, Germantown, Collierville, and so on, and they've had very low, in some cases, no transmission they've been able to pull it off. And I think there are a couple of studies, big national studies, that have shown that schools, particularly at the lower age, have not been the sources of spread that people feared. But it is, I'm not advocating, I'm just saying it's an incredibly complicated decision. Let me stay with you, Dr. Haushalter. We mentioned the rural communities, and both of you have talked about, or I think Mayor Harris talked about, the closure of some of the rural hospitals in West Tennessee. Are we seeing the hospitalization rate in Memphis, with all of its hospitals and all of its resources relative to the rural communities? Is it going to be overwhelmed by rural patients? I don't mean that in an ugly way. I mean that in a data way. Is that part of what could potentially strain the health system here?
So it's actually already straining our health system. As our numbers started to go up, we asked the healthcare systems locally to tell us what proportion of their patients were out of county patients. And in one hospital, as low as about 25%. That's still a quarter of their patients. In another, it was closer to 40%. So it's already impacting our healthcare systems. And as the thing to think about with rural counties, because they don't have access to a hospital readily, individuals may delay seeking care. So by the time they actually come to Shelby County or another metro area for services, they actually are much sicker because they have delayed receiving care potentially. So we do anticipate that it'll continue to impact our system locally. I want to reinforce Mayor Harris's comments earlier about the importance of Medicaid expansion and assuring that all people have equal access, not only to health insurance, but to healthcare systems and hospitals.
One more question for both of y'all, and then I'll see if Bill has any wrap-up stuff. And sorry, Bill, I'm dominating here for a second here at the end. But we have a President-elect Biden is coming in and will not be inaugurated and take office till January 21st. They've announced a coronavirus task force. For you first, Dr. Haushalter, and then for you, Mayor Harris, what would you like to see from the new administration that you're not getting now from the federal government?
It really is consistent messaging and role modeling. While there may be messages coming from some federal agencies currently around masking, that's not being role modeled by leaders. So it is the policy component, the data component, and evidence-informed decision-making, but also role modeling.
Mayor Harris, same question. What do you want to see?
Right. So I want to see this election come to an end. I think that's step number one. And then once this election comes to an end, I think that we'll be in a place to talk more to the federal government. I really haven't thought about it very much, to tell you the truth, because we're always in the midst of something at the local level at this point. But one thing I will say is I do think at the federal level, the signal has been sent that politics is sport, and that people think of politics as sport and combat and name calling and so forth. And politics is not sport. Politics is service. And so I'm just hopeful that as we turn the page, that we kind of come back together, whether you're Democrat or Republican. And I've never had an ill word for Donald Trump, neither on Twitter or anywhere else, that we all come back together and just remember that this politics and government is about service and about helping people. And I think if we can get that to kind of focus our attention, I think we'll get a lot of things done.
Bill, did you have anything else you want to touch on?
Yes, just the logistics of distributing a vaccine, wherever that may come from. Where are discussions and specific logistics on that at this point?
So there's been a lot of discussion already. There's regular planning sessions. There will be a tabletop exercise in the upcoming weeks that we'll participate in. The state is the lead agency, but then they work with each of the metros and the rural communities and the various partners to look at logistically how you get the vaccine here. When the vaccine arrives, where is it stored? And then how is it deployed to the field? And which partners can assist with deploying to the field. As everyone knows, we do flu vaccine clinics throughout the fall, and we'll be doing some very rapid flu, what we call pods, but drive-throughs that's really in readiness for the vaccine for COVID. I would say everyone needs to know locally, particularly since 911, there's been a lot of effort put into how do you deploy mass prophylaxis or vaccine in the event of an emergency. So that's one area I think the United States has been prepared for some time.
Mayor, is this going to be free?
If I have anything to do with it, yes.
All right,
Okay.
we will leave it there. Thank you all who joined us for this extended version of the conversation. Obviously, hugely important stuff. I could have talked for another 20 minutes with you all, but I appreciate your time. Thank you for listening to the podcast, and join us again. Subscribe to the podcast. Thanks for being here.